And the COVID positivity rate in Fresno County higher than it's ever been. The number of cases surging and hospitalizations skyrocketing. Madaris Babb joining us from CRMC with a breakdown of what is happening locally. Madaris.
Stephanie, here in Fresno County, there's now more than 560 COVID-related hospitalizations, which is the highest that it's been in the last year. And with cases on the rise, officials are bracing for what's next.
We're getting tested. Our kids were exposed to COVID in their child care center.
Cindy Hernandez and her children, which are all under the age of 4, waited in line at the UCSF COVID Equity Project site to get tested. This is the third time her children have been exposed to COVID at daycare since the new year.
It's every time. I have 3 kids in care, so every time one of them gets sick, then we all have to quarantine, and it's like, okay. It's a lot and it's expensive.
COVID swabs are in high demand in the county as Omicron surges, with this time lapse showing the line at the UCSF testing site. According to state data, Fresno County has hit an all-time high of test positivity rate for COVID-19 at 33%. That means for the last week, 1/3 of tests administered in the county have come back positive. The previous record was recorded during the January 2021 winter surge at a 19% test positivity rate.
As you can imagine, the hospitals in our EMS system are really being challenged right now.
The case rate having a domino effect, with COVID-related hospitalizations in Fresno County now over 560, a 270% increase since Christmas. The last time there were this many COVID-related hospitalizations was back in January of last year at around 660 COVID-positive patients. St. Agnes Medical Center says staffing and bed space are the biggest issues.
The hospital is basically at capacity, and so trying to get patients that do need to be admitted up to a bed is really is a significant challenge for us at this point in time.
Now, officials say, unlike other surges, this one we're not seeing the ICU beds be as impacted, but still hospitals are filled to the brim. And officials tell me that they do have a plan in place in case they have to open an alternative care site. In fact, they say that those sites will be at the hospitals, so they'll just expand the hospital beds around here if that does have to happen, but they're not doing that just at this point. Reporting live from downtown Fresno, Madaris Babb, KC24, local news that matters.